I'm Lottie Derby. I'm a professor of medicine and medical education at Mayo Clinic. I'm also co-director of the Mayo Clinic program on physician well-being. I'm going to be discussing the article Medical Licensure Questions and Physicians' Reluctance to Seek Care for Mental Health Conditions, which will appear in an upcoming issue of Mayo Clinic Proceedings. The prevalence of psychological distress among physicians is high, and for many physicians their mood disorder goes untreated, contributing to a higher prevalence of suicide among physicians in comparison to other U.S. workers. Physicians frequently self-treat for depression and avoid seeking care for mental health conditions due to concerns it'll affect their medical licensure. For example, in a 2008 national study of over 7,000 U.S. physicians, 6% reported experiencing thoughts of suicide in the last 12 months. And among those with recent thoughts of suicide, only 26% had sought care. 16% had self-prescribed their antidepressant, and 60% reported reluctance to seek care due to concerns that doing so would affect their licensure to practice. This is actually a reasonable concern, as many state licensing boards ask questions about mental health diagnosis or treatment. And a study in 2007 reported that greater than one-third of state licensure board executive directors reported that a diagnosis of mental illness was itself sufficient to sanction physicians. There are also reports of disclosure of mental health conditions resulting in overt and covert discrimination, as well as public disclosure of physicians' personal health information. The fact that licensing boards inquire about these dimensions is believed to be a major deterrent for help seeking among troubled physicians, many of whom have treatable disorders. Now, state licensing boards serve an important function to protect the public through licensure, surveillance, misconduct investigation, and disciplinary actions. The Federation of State Medical License Boards advises that medical license boards not ask physicians about history of mental illness, and indicates that doing so could be a violation of Americans with Disability Act of 1990. The American Psychiatric Association also specifically states that impairment and potential risk of harm to patients cannot be inferred from diagnosis or treatment alone. Indeed, the American Medical Association and others have called for medical license applications to only ask questions about current functional impairment of professional performance, and for decisions regarding licensure to be based solely on professional performance. So in this study, we obtained nearly all medical license boards' initial and renewal licensure applications and reviewed the application questions pertaining to physicians' mental health, physical health, and substance use. Questions were classified as being consistent with the American Medical Association, the American Psychiatric Association, the Federation of State Medical Board policies and recommendations, and with the American Disabilities Act of 1990 if they inquired only about current impairment from a medical condition or mental health condition, or did not ask about mental health conditions at all. In addition, we also surveyed a national sample of U.S. physicians and asked them about their state of employment, as well as if they were willing to seek medical help for treatment of depression, alcohol use, or other mental health problems, or if concerns about repercussions to their medical licensure would make them reluctant to seek formal care. In our study, we found that only one-third of states currently have medical license application questions about mental health on their initial and renewal application forms that are congruent with the American Medical Association, American Psychiatric Association, and the Federation of State Medical Board policies and recommendations, or in clear compliance with the ADA Act of 1990. Nearly 40% of the physicians who responded reported that they would be reluctant to seek care for a medical problem, for a mental health condition, due to concerns about repercussion to their medical licensure. We also found that physicians who worked in states with medical licensure questions regarding mental health that were consistent with national recommendations were less likely to report that they were reluctant to seek formal medical care for treatment of a mental health condition due to concerns about repercussions to their medical licensure than physicians who worked in states where the medical license application questions asked about mental health in terms of their history of impairment, diagnosis of a mental health problem, or treatment of a mental health problem. This relationship between the way state medical license boards inquire about mental health conditions was independently related to whether or not the physician in that state reported a reluctance to seek mental health care, after adjusting for sex, age, relationship status, practice setting, and even specialty. Physicians working in states where neither the initial or the renewal application were consistent with recommendations, they had a 21% increase in the odds of being reluctant to seek care for a mental health concern. Even physicians working in states where only the initial license application was not consistent with recommendations, they had a 22% increase in the odds of seeking help for a mental health condition, independent of age and a variety of other factors. This observation suggests that questions on the initial licensure application can have a lasting impact on physicians. Large population studies have found that attitudes toward mental health help seeking are associated with actual mental health care service use. If, as observed in large previous national studies, 6% of the more than 800,000 U.S. physicians have experienced suicidal thoughts in the last 12 months, and 40% of those with suicidal ideation do not seek care due to concerns it may have repercussions for their medical license, this would imply licensure concerns may be a factor in 20,000 U.S. physicians not receiving the professional help they need for mental health conditions. There's a moral and ethical imperative to reduce barriers to help seeking for all individuals. Untreated psychological problems contribute to broken relationships, alcoholism, and suicide. For patients to receive the very best care from caring and compassionate physician, their physician needs to be well. And in this regard, the American Psychiatric Association has already developed and recommended the following language for state licensing boards to use on licensure applications. Are you currently suffering from any condition that impairs your judgment, or that would otherwise adversely affect your ability to practice medicine in a competent, ethical, and professional manner? Such a question encourages physicians to consider any physical or mental health condition that could impair their performance, and helps to destigmatize mental illness. In addition, it also enables state medical boards and their members to protect the public while being consistent with the Americans with Disability Act of 1990. Although there are concerns that the very nature of some illnesses could impede physicians' ability to recognize their own limitation, a history of a medical or psychiatric disorder has little predictive value for present impairment of functioning. And there's no evidence that the risk to patients is sufficiently great to require disclosure of a private medical records for public scrutiny. Next steps include continued efforts to identify ways to encourage physicians to seek help. This includes efforts to improve physicians' ability to assess their level of distress, recognize when they need help, willingness to seek help, and reduce barriers to accessing care. Changing medical license application questions, as well as similar items asked by hospitals and group practices in the credentialing process, so that they inquire only about current functional impairment, appears to be a simple but potentially meaningful step to reduce the barriers to physicians seeking help for mental health condition. Such a change, although potentially cumbersome, as state medical boards may need to work with their legislators for changes to the State Medical Practice Acts, could be implemented at minimal cost and reduce a barrier to help seeking for physicians in distress.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.